Medical coding translates medical services into special codes, which are essential for the healthcare system to function efficiently. These codes are not just random numbers. They are carefully structured to represent specific diagnoses, treatments, and procedures. These codes tell a story about the patient's visit, explaining what was wrong and the treatments provided. They serve as a universal language that healthcare providers use to communicate with insurance companies, ensuring that the services rendered are accurately documented and billed. This process is essential for doctors to get paid and to create accurate medical records. Without precise coding, the entire billing process can become chaotic, leading to financial losses for healthcare providers and confusion for patients. Accurate coding ensures everyone understands the care given, vital for the healthcare system to function smoothly. It allows for seamless communication between different departments within a hospital and between various healthcare facilities. If codes are wrong, payments can be delayed or denied, affecting a clinic's revenue. This can lead to a cascade of issues, including the inability to pay staff, purchase necessary medical supplies, or invest in new technology. Accurate codes ensure patient records are correct, used for ongoing care, research, and public health studies. These records are crucial for tracking patient outcomes, identifying trends in healthcare, and conducting medical research that can lead to new treatments and cures. Incorrect codes often lead to claim denials, creating more work to fix errors and resubmit claims. This not only wastes time but also increases administrative costs, which can be a significant burden for smaller practices. Frequent errors can trigger audits, which are time-consuming and stressful. Audits can disrupt the daily operations of a medical practice and divert resources away from patient care. In some cases, incorrect coding can lead to legal problems. Healthcare providers may face fines, penalties, or even lawsuits if they are found to be in violation of coding regulations. Patients might become unhappy if billing errors cause confusion or financial stress. This can damage the trust between patients and their healthcare providers, leading to dissatisfaction and potential loss of business. Medical coders play a crucial role, acting as translators of medical language into universal codes. Their work ensures that the complex information in a patient's medical record is accurately captured and communicated. This requires a deep understanding of anatomy, medical terms, and specific coding rules. Coders must stay up to date with the latest coding standards and guidelines, which are constantly evolving. Coders must strive for accuracy and ethical standards. They have a responsibility to ensure that the information they provide is truthful and precise, as errors can have serious consequences. Continuous learning is part of the job, as coding rules and guidelines change often. Coders must regularly attend training sessions, webinars, and conferences to stay informed about the latest developments in the field. By staying current, coders help their employers receive proper payment. They ensure that claims are submitted correctly the first time, reducing the likelihood of denials and delays. They contribute significantly to the financial health and compliance of the medical practice. Accurate coding helps maintain a steady cash flow, which is essential for the sustainability of any healthcare facility. Their diligence protects both the provider and the patient. By ensuring that medical records are accurate and up to date, coders help safeguard the quality of care and the integrity of the healthcare system. CPT codes are key in medical billing, serving as a universal language that translates medical procedures into standardized codes. These codes represent specific procedures or services, ensuring that every medical action is accurately documented and billed. For general surgery, CPT codes describe operations like appendectomy or hernia repair. These codes are crucial for both clinical documentation and reimbursement. Using the correct CPT code ensures clear communication about services rendered, reducing the risk of errors and denials in the billing process. The CPT codebook is organized into sections, with Category 1 codes being the most common. These codes cover a wide range of medical services and procedures. General surgery codes are found in the surgery section, divided by body system. This organization helps medical professionals quickly locate the appropriate codes. When coding for general surgery, follow specific CPT guidelines and read notes around the code. These notes provide essential details that can affect coding accuracy. Modifiers, 2-digit codes added to a CPT code, provide more information about the procedure. They can indicate if a procedure was altered or if multiple procedures were performed. Understanding the global surgical package, which bundles services typically included in a surgery, is vital. This package can include preoperative, intraoperative, and postoperative care. Many CPT codes are commonly used in general surgery, like appendectomy and cholecystectomy. These codes are frequently referenced and must be well understood by medical coders. The specific code depends on the type and location of the procedure. Accurate coding ensures proper billing and reimbursement. The surgeon's operative report is the source document for selecting these codes. It provides a detailed account of the surgery performed. Careful review of this documentation is essential for accurate CPT coding. Ensuring that all details are correctly captured can prevent billing issues and improve overall efficiency. ICD-10-CM codes report diagnoses, describing diseases, symptoms, injuries, and reasons for patient encounters. Every general surgery procedure must be linked to an ICD-10-CM code to show medical necessity. The ICD-10-CM codebook has two main parts: the alphabetic index and the tabular list. Coders should use both parts to find and verify the correct code. ICD-10-CM codes can have 3 to 7 characters, each adding more specific information. Specificity is crucial, such as indicating laterality or the type of encounter. This detailed information supports the medical necessity of surgical procedures. General surgery practices use many common ICD-10-CM codes, like those for acute appendicitis or gallstones. It is vital to link the correct diagnosis code to the surgical procedure code. Accurate diagnosis coding is as important as accurate procedure coding for reimbursement. HCPCS codes are another important coding system divided into 2 levels. These codes are essential for the accurate billing and documentation of medical services and supplies, ensuring that healthcare providers are reimbursed correctly for the care they provide. Level 1 is CPT codes, used for reporting physician services and procedures. These codes are standardized and widely recognized, making them a critical component of medical billing. Level 2, maintained by CMS, reports services, supplies, and equipment not covered by CPT codes. This level includes a wide range of items, from medical equipment to specific medications, and is crucial for comprehensive billing. General surgery practices use both CPT and HCPCS Level 2 codes for complete billing. This dual coding system ensures that all aspects of patient care, from the surgical procedure to the supplies used, are accurately documented and billed. HCPCS Level 2 codes cover items like medical supplies, injectable drugs, and durable medical equipment. These codes are essential for billing items that are not directly related to the surgical procedure but are necessary for patient care. For general surgery, these codes are often used for items supplied during or after a procedure. This includes everything from surgical trays to postoperative care supplies, ensuring that all necessary items are accounted for in the billing process. Understanding when to use HCPCS Level 2 codes is essential for capturing all billable services. Proper use of these codes can prevent billing errors and ensure that healthcare providers receive appropriate reimbursement for their services. For example, a special surgical tray used during an operation or specific medications administered to the patient might be billed using HCPCS codes. These codes ensure that all aspects of patient care are documented and reimbursed. After surgery, items like support garments can also be reported with HCPCS Level 2 codes. These garments are essential for patient recovery and must be included in the billing to ensure comprehensive care. Just like CPT codes, HCPCS Level 2 codes can use modifiers to provide additional information. These modifiers can indicate specific details about the service or item, such as the location of the service or the reason for the supply. Imagine a patient undergoes a complex hernia repair using special surgical mesh. The use of this mesh must be documented accurately to ensure proper billing and reimbursement. The hernia repair is coded with a CPT code, the diagnosis with an ICD-10-CM code, and the mesh with a HCPCS Level 2 code. Each code plays a vital role in the billing process, ensuring that all aspects of the patient's care are covered. All these codes must be included on the claim form to ensure complete and accurate billing. Proper documentation and coding are essential for the financial health of healthcare practices and the delivery of quality patient care. Healthcare providers are paid by private and public payers. Private payers are commercial insurance companies, while public payers are government-funded programs like Medicare and Medicaid. General surgery practices bill both types of payers regularly. Billing private insurance involves verifying patient eligibility, pre-authorization, and understanding payer-specific rules. After a claim is processed, the payer sends an explanation of benefits, EOB. Billing Medicare requires following CMS rules, including national and local coverage determinations. Sometimes, an advance beneficiary notice of non-coverage, ABN, must be given to the patient if a service might not be covered. Medicare has different parts, with general surgery physician services typically billed under Part B. Medicaid rules vary by state, so coders must be familiar with their specific state's guidelines. Dual-eligible patients have both Medicare and Medicaid coverage, with Medicare usually paying first. Accurate billing and reimbursement require understanding the specific rules of each payer. Accurate reimbursement starts with complete and precise physician documentation. Coders should query the physician for clarification when needed. Clear documentation supports the codes chosen and helps defend against audits. Good communication between coders and physicians is essential for optimal payment. The world of medical coding is always changing, with annual updates to code sets and payer policies. Coders must stay updated through workshops, webinars, and professional organizations. Implementing internal audits and maintaining a compliance plan are vital for accurate reimbursement. Regular internal audits help identify coding errors and areas for improvement. A formal compliance plan outlines the practice's commitment to ethical coding and billing. Effective claim follow-up and denial management are crucial for maximizing revenue. Understanding why a claim was denied and correcting it for resubmission or appeal is important. By diligently following up on unpaid claims and managing denials, practices can recover lost revenue and reduce future denial rates.